More than 90% of men will experience prostate enlargement at some point in their lives. The prostate starts growing slowly around age 25. After decades of gradual growth, many men don't notice it until their 40s or 50s. Today, let's talk about this sensitive issue. First, let's make it clear, what exactly is this enlargement? Medically, it's called benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate tissue. The exact cause isn't fully understood, but it's known to be closely linked to aging, the effects of androgens, male hormones, and an imbalance in tissue repair. Simply put, as you age, hormonal changes slowly make the prostate gain weight, while its ability to repair itself declines. Many men between 40 and 59 find their prostate volume has increased during checkups, but not everyone has symptoms. It only becomes a health concern when the enlarged gland actually affects urination. So how does it make you uncomfortable? An enlarged prostate creates pressure in two directions. It pushes upward against the bladder, reducing its storage space. It also squeezes inward on the urethra, narrowing the passage. This triggers a chain of reactions. Straining to urinate is the most typical sign. The urine stream becomes weak, doesn't go far, you often need to push, and it takes longer to finish. Over time, this causes the bladder muscle to thicken and its ability to hold a large amount of urine decreases. The direct consequences are frequent nighttime urination, your sleep is constantly interrupted. Urgency and frequency, you feel like you need to go again right after peeing, or you suddenly can't hold it. Dribbling after urination, that annoying feeling of not being fully empty. All these symptoms come from the enlarged gland pressing on the urethra. What happens if you ignore it? If you neglect it for a long time, the most immediate danger is acute urinary retention. You suddenly can't pee at all. Your bladder fills with urine, causing severe pain. More worrisome are the long-term effects. Severe, ongoing blockage can cause urine to back up into the ureters and eventually reach the kidneys, damaging them. If not treated in time, some patients may develop chronic kidney disease and even require dialysis. Here's a statistic worth noting: about 1 in 5 men with BPH who don't get treatment will see their symptoms worsen within 5 years. And among those with moderate to severe symptoms, about 10 to 25% may need surgery within 3 to 4 years. One important clarification: enlargement does not equal cancer. Many people get nervous when they hear enlargement or growth, worrying about cancer. Remember, BPH is benign, it's not prostate cancer. That said, regular checkups to monitor both conditions is a smart practice. Understanding it helps you manage it better. We hope every man can face this normal bodily change with confidence and take action when needed. With 3D animations like this, we turn complex medical processes into intuitive, easy-to-understand visual language. We are a professional medical visualization team, specializing in delivering customized 3D animation solutions for the medical and healthcare industry.